Well, you've almost convinced me, but I want to know, what do other Americans think?
Well, actually, polls show that 82% of Americans are dissatisfied with the expense of our healthcare system, and almost 60% are very dissatisfied. But in spite of their dislike of the cost, people still feel that having close to 50 million uninsured is even more serious than the high cost. People even place full access to healthcare coverage above the desire for tax cuts, and everyone knows how we Americans love our tax cuts.
So, how come single payer is hardly ever in the news on TV? I don't hear about it.
Well, the major media networks in the U.S. are extremely dependent on the huge sums of ad money from the private healthcare industry. This gives the for-profit industry enormous control over what the networks air. Because of the overwhelming success of national healthcare in so many other countries, the for-profit healthcare industry is terrified of the U.S. enacting a national healthcare system. In fact, they spend millions a year spreading lies about government-run healthcare systems. Sadly, they've been successful in drowning out logic and reason and in eliciting fear of anything with the word government in it. Success that is mainly due to their control over media networks. The result is very serious bias in all coverage of healthcare reform, which denies the public the right to hear the truth.
Yeah, I've heard some scary stuff about healthcare in other countries and such, online and in the news.
Okay, well, what exactly have you heard?
Well, I've heard there are really long waiting lists in other countries.
Speaking of wait lists, we have almost 50 million people who would love to be on a wait list, all those who are not insured at all. At least in single payer systems, it's doctors who decide who is put at the top of the list based on need, not some insurance bureaucrat based on profit margin. Wait times are more a result of too few doctors to support the number of people needing care. Remember, other countries are experiencing the same population increases and baby boomer phenomenon that we are. That has nothing to do with whether a system is a single payer or not. The single payer system we are advocating does one thing and one thing only. It handles the medical bills for much less cost.
Okay, so what about government bureaucratic interference?
Wendell Potter spent many years as a top-level executive in the for-profit health insurance industry before his conscience forced him to quit and become a whistleblower. He tells us that private insurance companies hire thousands of people whose only function is to limit your treatment options or deny your claim entirely. So your money is used to pay people specifically to limit or deny your claims. Under the single-payer system, treatment decisions would be made only by your doctor and you.
Okay, but I don't like the idea of socialism.
Well, the truth is, our proposed single-payer system is as American as the fire department, the water department, public schools, the police department, and so on. And, like the public services on this list, the removal of profit allows higher quality at much lower cost. In a nutshell, single payer shifts the goal from making a profit by denying services to improving health through providing services. But unlike the public services on this list, which are socialized and work very well, medical providers will not be employees of the government. They will remain private. They will simply not be investor-owned.
Okay. But what about all those stories about Canadians flocking to the U.S. for medical services because their own health system is so bad?
Well, this slide shows the facts. The percentage of our population seeking medical services abroad is more than twice that of Canada's. So, if these stats indicate a problem with Canada's health system, then the same stats indicate that ours is more than twice as bad. Are you convinced yet?
Okay, you're right. I admit single payer does sound like a wonderful plan. But if the private industry is as powerful as you say, then shouldn't there be some sort of compromise plan in case it just doesn't pass?
Most people agree that if we're unable to get Congress to pass single payer, we should push for a bill which at least includes a public plan to compete with private insurers to bring their prices down and cover everyone who is uninsured. at least take a step in the direction of a future single payer, right?
Exactly.
Well, in the main bill being considered by the House, the so-called public option is neither public nor an option for most Americans. The biggest problem in it are the same kind of intentionally hidden problems that we have to guard against in any healthcare bill being considered in Congress. There are major concessions to the private industry intentionally hidden away in the legalese. In this bill, they actually redefine certain common words to make it sound like real reform, while they are actually stabbing any true reform in the back.
What? What do you mean?
Well, I'll explain that now. But first, note that this bill would add over $1 trillion to our national budget because it keeps all the private insurance companies with their inefficiencies and profits. Okay, the first hidden problem. Now, you've said that you and your family are covered through your husband's employment, right?
Yes, that's right.
Well, if this bill passes, you and your family, like all others who are covered by employer-supported insurance, will be locked into your existing plan for up to 5 years or more, even if your plan costs more and gives fewer benefits than the new public plan. You will not be allowed to use the exchange.
Well, but what if the employer wants to change to the public option or some other plan?
That won't be permitted either. The bill uses the term grandfathering to describe this denial of choice, even though traditionally the term has always meant greater choice. This lock-in cherry picks the healthiest members, all those healthy enough to be working, by locking them into their private plans. So the public plan is left with the less healthy, more expensive members.
Isn't that really the same thing the Advantage plans are doing to Medicare?
Excellent observation, Clouseau. That is exactly right. And to seal the fate of the public plan, it would not be allowed to receive any subsidies to make up for this cherry picking. Instead, it's required to be funded totally by premiums. Another problem is, this bill also requires the public plan to use provider networks, which limits your choice of providers. Also, coverage is not comprehensive. Many things are left completely or partially not covered. A very major concern is that it still leaves millions uninsured, and it does not eliminate out-of-pocket costs. The bill requires the public plan to be funded entirely through tiered premiums, which pay for tiered benefits.
What is a tiered premium or tiered benefit?
Well, basically, it's the same system that we have now, where the best coverage is priced the highest, so just like now, only those who can pay the most get the best coverage. The bill allows premiums to be doubled as people age, and it forces people to buy insurance and fines them if they don't.
That doesn't sound right. So, how can we make it right?
Well, here's what we can do. Insist that legislators fix the public plan with any bill they are considering before it is passed. Fixing it requires making the public option an improved, expanded, Medicare-like plan available to every American from day one, totally publicly funded, no premiums or tiered benefits, and fully comprehensive. However, something called the Wiener Amendment would be the best fix. It will change the current bill into H.R. 676, which is the universal single-payer system we just described to you in this presentation.
So can we really pass a single-payer bill?
Yes, we can, but it's not going to be easy. It'll require all of us to take action because the major media networks receive millions upon millions from the private industry. Even though reporters and camera persons are often in agreement with us, the owners of their networks make sure the editing strongly favors the status quo. So call, fax, and email the White House, your legislators, and all legislators who are on committees dealing with health care reform. Tell them that you are a single-issue voter this time, and that your issue is the single payer for all. It is also important to spread the word to everyone you know to pressure the legislature and the White House.